Hello and welcome. My name is Angela Porter. I'm a registered nurse at Cadleck Regional Medical Center here in Richland, Washington, where I care for patients daily on the acute care oncology floor. I'm also currently pursuing a Bachelor's of Nursing degree at Columbia Basin College. Today I will be examining and presenting research and implications for the use of Dronabinol in the treatment of chemotherapy-induced nausea and vomiting, or CINV. So a little bit of background. The American Cancer Society estimated there to be over 1.6 million newly diagnosed cancer cases in 2017 alone. Mathematically, that works out to almost 5,000 per day. Chemotherapy, being the most common both curative and palliative treatment, has many side effects. Nausea and vomiting are the primary concern amongst patients receiving chemo. Over half of these patients report CINV, and most cases are uncontrolled. We all know patients need rest, nutrition, and hydration in order to heal, but oftentimes that's not possible when they experience such nausea and vomiting. There are many interventions available to control nausea and vomiting, but oftentimes patients still experience their debilitating symptoms. A better treatment is needed and might exist in the use of the cannabinoid Dronabinol, more commonly referred to as Marinol. This information led me to pose the following question. Among inpatients with cancer who are undergoing chemo and experiencing chemotherapy-induced nausea and vomiting, would treatment with Dronabinol or treatment with more common antiemetics provide more relief from the symptoms of CINV during the course of active chemo? Although more research is needed, I examined 3 current peer-reviewed journal-published research studies regarding this matter. The studies were then compared and contrasted for similarities and disparities between each. I will briefly review each study. The first study was a 2015 study published by the American Cancer Society, which was conducted by Joan Kramer. The researcher reviewed current PubMed research into the usages of marijuana and other cannabinoids. In her study, titled Medical Marijuana for Cancer, Kramer concluded that both cannabinoids and marijuana could be more effective than current pharmaceutical treatments for nausea and vomiting related to chemo. In the next study, a 2016 one published in Cancer Management and Research, conducted by Megan May and Ashley Glode, titled Dronabinol for Chemotherapy-Induced Nausea and Vomiting Unresponsive to Antiemetics, the role of Dronabinol was also reviewed. The researchers conducted a meta-analysis of over 1,300 patients in 30 randomly controlled trials and concluded that Dronabinol was more effective than current antiemetics and could be used either in combination or as a monotherapy effectively. Finally, a 2015 study published by Clinical Therapeutics conducted by Reichenbach et al., titled A 4-Week Pilot Study with the Cannabinoid Receptor Agonist Dronabinol and its Effect on Metabolic Parameters in a Randomized Trial, similarly examined the effects of Dronabinol, this time focusing on its ability to affect metabolic function. The researchers conducted a double-blind, placebo-controlled trial on 18 patients who were undergoing both chemo treatment and treatment with Dronabinol to conclude that the cannabinoid did not negatively affect metabolic parameters in patients undergoing treatment. So between all 3 studies, there were a few similarities. Each of the studies involved patients who had a cancer diagnosis who were undergoing chemotherapy and experiencing CINV. Patients in each study found relief from symptoms through the use of cannabinoids. Ultimately, each study agreed that further research is needed in order to determine appropriate dose, rate, route, strain, and so on. Lastly, each researcher noted a limited availability of participants given both legality and personal belief issues surrounding the use of marijuana, despite increasing acceptance. As for study validity, the studies are all clinically significant in that they determined a decrease in the symptoms of the number 1 most feared side effect of chemotherapy. In both inpatient and outpatient chemo settings, the debilitating effects of the cancer and chemo are widespread and obvious. As medical professionals, we owe the duties of beneficence and non-maleficence towards our patients. Continuing to ineffectively treat CINV is doing a disservice to those we treat, especially when effective interventions exist in the use of Dronabinol. A few implications to practice. As yearly cancer diagnoses creep up on 2 million, it's imperative to afford patients every advantage available to them. As medical professionals, we know that treatment with chemo is often more debilitating than the cancer itself. When uncontrolled CINV affects more than approximately 1 million patients, it's time for a change. As an RN who has dedicated her work to caring for patients with cancer, I propose a change in how CINV is treated. We owe it to our patients to give them the upper hand. I have personally seen patients treated with many forms of antiemetics, including Dronabinol, and formulated this question in research review as I suspected Dronabinol was much more effective treatment based on repeated daily patient observations. Currently, only those patients who are admitted with a prior current prescription for Dronabinol are treated with this intervention in the hospital setting. Especially in states where treatment with cannabinoids is legal, patients with CINV should be prescribed the most effective treatment, and evidence-based research points to Dronabinol in such cases. So let's help enhance our patients' quality of life. Inpatients who are experiencing CINV should be prescribed Dronabinol as a treatment option, much like they are other antiemetics. Constant and refractory nausea and vomiting prevents patients from achieving the rest and nutrition and hydration status they so need to heal. When Dronabinol is used to effectively treat the symptoms of CINV, the quality of life for our patients will greatly improve. I propose that education be provided and Dronabinol be prescribed as needed as a nausea and vomiting treatment option for all inpatients with cancer. The signs and symptoms of nausea and vomiting for all patients with cancer should be scored every 4 hours on a numerical scale, such as those commonly used for pain, so both the patient and nurse can adequately assess the severity of symptoms and the effectiveness of treatments provided. Of course, patients may choose to decline any treatments they choose, so the number of patients who use Dronabinol will be dependent on each patient individually. The scores should also be recorded anonymously on paper for each patient, with the treatment administered noted. These should be placed together in a chart for later evaluation. The scores and interventions should be reevaluated 6 months after the implementation of Dronabinol as a hospital-prescribed medication occurs to examine the efficacy of the cannabinoid. In conclusion, in patients battling cancer, chemotherapy can yield many debilitating side effects, including chemotherapy-induced nausea and vomiting that is refractory to current treatments. An effective, tested, and evaluated evidence-based treatment exists in Dronabinol. As healthcare professionals who assume this position to care for every patient to the best of our ability, we owe it to them to implement the most safe and effective treatments possible. We owe it to them to offer Dronabinol to help treat CINV and, in doing so, help them fight cancer. Thank you.